Yeah, we talk about like ER doctors being really well rounded. I think ICU doctors are some like the most knowledgeable people, man. Like,
They're
they're
so smart.
yeah, like some of the most knowledgeable doctors, I think. Yeah.
Yeah, they're like one of the few where like I'm still, I wouldn't say intimidated, but I get my story straight before I call the
Yes,
ICU.
yes.
Like the hospitalist, maybe I'm like, yeah, this is like an acute chole console surgery. They're not going to ask any other questions, clean, simple. But any ICU patient, I'm like, did I miss anything? I need to make sure I have everything.
That's so
in
true.
row.
That's a universal experience.
Both parents work, but neither of them have health coverage?
Orlando and his wife have multiple part-time jobs that don't offer insurance.
Can they qualify for Medicaid?
Unfortunately, no, because their combined annual income is over the Medicaid threshold for a family of 5.
So they make too much money?
And not enough at the same time. They live over the poverty line, and yet they are still living paycheck to paycheck. I think their best option would be to buy private insurance through the Affordable Care Act.
I'm sorry, Anna.
How much will it cost to keep my dad in the hospital?
I don't know. But the ER visit alone will likely be in the thousands. We will figure something out, okay?
Yeah, it's just such a tough situation when it comes to this. And this is the reality for like millions of Americans. This isn't like an isolated thing where, you make a certain amount and you don't qualify for health insurance. You work a bunch of part-time jobs, so they don't provide health insurance. And then on the flip side, if you want to buy insurance in the marketplace, it's going to be insanely expensive.
Yeah.
I pay hundreds of dollars for like a high deductible plan, and I'm like a younger, healthy person.
Yeah.
Now, obviously, if you're not a young, healthy person, you've got diabetes, hypertension, you've got a history, buying something through the ACA for your family, that's going to be thousands of dollars a month. And at the same time, you're not, poor enough to afford Medicare. And so, we see patients like this all the time. And what happens is, they can't get their medications filled, or maybe they need to be admitted and they won't want to be admitted because that bill's going to cost them so much. And they're going to show up again tomorrow or the next day unconscious. And now the situation's even worse. And so it's just very tough, I think, for those of us that have health insurance or, it's provided by your job. You don't think of this.
Yeah.
And you think, and unfortunately, there's this kind of stereotype where, those that don't have health insurance, they don't have good jobs or they're not working. So the jobs aren't providing insurance. But you have like this situation where this guy's working like multiple jobs and they're just in this, they used to call it a donut hole. Where they're in this donut hole where you can't get health insurance. And like, I just think about that. I'm like, I'd like bang my head against the wall. I'd be like, what do I have to do to get like this thing that I feel is like a human right? But yeah, that's why I picked this, where it's, we think of a lot of times like the news will say, oh, this many million people are going to lose health insurance because of this bill. And you just see it as a number, but like that's like 17 million or 20 million, whatever that number is of these instances happening.
Yeah, we have what you said, like that gig economy, all these like little side gigs that brings in a lot of money, but don't bring the traditional benefits in. It limits people from getting health care. And like you said, the Affordable Care Act, you can get stuff on the marketplace. I've never really went to it. I don't know how much it costs. I know there are some subsidies that are kind of going away and they're raising premiums now, but it's an unfortunate situation. And it's like this guy's just, working hard, his family's working hard, and they can't afford to get basic care. And, it happens to a lot of people.
Yeah.
Yeah, no, I think what you said about how as physicians, we don't really consider this side. Like, we don't learn it when we're in medical school. And I think maybe, and I hope that the curriculum is changing where we are exposed to more of this, where we challenge ourselves to really think behind not just the medical facts and the care that we're delivering, but truly how it's delivered, right? I think it's so important. And so I'm just speaking as an oncologist. Cancer care is really expensive, right? Not only the drugs, but having access to all the specialists, having to go for the actual infusion appointments, it's a lot. And so in cancer care, we talk a lot about toxicity. And by toxicity, we're often very focused and anchored on the side effect profile. Nausea, vomiting, you're going to lose your hair, your blood counts, risk for fever, you name it. But there's also this whole other aspect of toxicity, financial toxicity, right? And I think this highlights that. And then also time toxicity. So, patients and their families have to spend a lot of time at cancer centers getting oncology care. And so I really like how this highlighted that aspect of toxicity beyond just the conventional side effects and symptoms that patients present with.
Yeah. One of the most, for me, helpless feelings in the ER is when I'm discharging a patient, they have no health insurance, and you say, hey, follow up with a cardiologist. You're ruled out for ACS. You're not in like a risk category where we have to keep you today, but follow up for anything. Yeah. And like I know deep down inside they don't have insurance. And a lot of people have insurance and they're like, the cardiologist won't take my insurance. There's like
Yeah.
one cardiologist in Houston that'll take in the wait's like 4 months.
Oh,
There's those situations, and there's like no more helpless feeling than that of like, I know I'm like discharging this patient. I'm doing everything right by what the system expects of me, but like I know this patient isn't going to get the care that they need or the resources that they need, and that's the unfortunate reality of practicing medicine in 2026 and in the U.S. system.